Good afternoon, dear students. Once again, we are with the radiology of urinary system. This would be the part two of the same. Now we'll discuss further diseases or conditions involving the urinary system. Now this is something normal uh, with which when we on the Doppler at the vesico-ureteric junctions, we can see the urinary jets coming into the urinary bladder, so indicating there is no obstruction at this level. This is sagittal or coronal view along with the stone, but still the urine is managed to come out. This is called partial obstruction. Now we move on to the next slide. This is intravenous pyelogram. You can see the right ureter filled with contrast and it's holding up the contrast, suggestive of distal obstruction. And if you look at the plain image, you can see a small stone just close to the vesico-ureteric junction marked by an arrow. Renal calculi we have seen in the previous study as well. This is a CT of the abdomen on the right of your screen and the plain X-ray abdomen on the left. You can see the stone in both images. Another axial scan at the level of proximal ureter. You can see the stone in the proximal ureter resulting in hydronephrosis. Now this is pyonephrosis, when there is long-standing hydronephrosis due to any kind of obstruction. There is infection in the pelvic calyceal system due to the stasis of the urine along with lot of bacteria, though that can lead to the pyonephrosis. As you can see, the dilated urinary system, they are showing a slightly gray density indicative of particulate material, and this is ultrasound picture. Now this is the PCNL study. You can see a small catheter at the top of left kidney which is dilated system, and contrast is given through the percutaneous nephrostomy. The whole system is outlined and you can see the filling defect at the lower mid segment of the ureter, and this is a stone which is causing obstruction and proximal hydronephrosis. There are certain conditions like transitional cell carcinoma. It may or can involve the ureter as well. This is the case where you can see on the left side the pelvic calyceal system is normal with normal excretion, while on the right side there is hydronephrosis and hydroureter, and there is cutoff of the ureter in the mid segment, and then you can see the contrast again in the right ureter coming down. The filling defect shows with ragged margins, and this is a typical picture of transitional cell carcinoma involving the right proximal mid-proximal ureter. This is a case of pyelonephritis. Usually patients come with flank pain. This is axial CT. You can see on the left side the difference between the two kidneys. Right kidney is normal, left kidney is slightly swollen with dilated pelvic calyceal system. and loss of normal pelvic system picture. Chronic pyelonephritis. See this difference between the left and the right kidneys. Left kidney is contracted, small and very small amount of contrast excretion. This is papillary necrosis, filling defects in the dilated calyces with evidence of papillary necrosis. The contrast was given retrogradely. If you look carefully on the right of your screen, you will see the catheters coming from the cystourethrogram or ureterogram. Not very common condition, herniation of the ureter, but still, if when it occurs, it should be noticed, it should be notified, or it should be diagnosed. You can see the ureter coming down well below the urinary bladder, anterior to the femur. So this is herniated ureter. Ureteroceles, again not very uncommon, but they do occur in small children as well as in young adults. And you can see a cystic structure present at the right vesico-ureteric junction. When the urine comes from the kidney, this balloons out, and then when the urine is pushed out from the vesico-ureteric junction into urinary bladder, it collapses. So it keeps on doing like this. This was a kid who was playing in the school and got trauma to the kidney. You can see the blood in the urinary bladder on the left, on the right of your screen. On the left side, you can see the kidney shows vascularity in the upper pole, whereas the left pole shows a hematoma and displacing the rest of the normal kidney. Another case of trauma, subcapsular hematoma, bone mark on the left kidney. It is enlarged and loss of normal renal pelvic system. Angiomyolipoma. Sometimes they are very tiny, benign lesions, but sometimes they are quite big and they may interfere with the renal function because of the compression. In this case, on the left side, you can see the excretion of the contrast through the left kidney, where the renal parenchyma is squashed against the large tumor. Now this is called the faceless kidney. Actually, this is again a condition in which there is no evidence of normal renal pelvic system. You can see only a wedge of the normal left kidney which is showing contrast excretion. The rest of the kidney is filled with a tumor, a mass, lymphoma, and many other conditions. Now, while studying the renal system, we have to see the suprarenal structures as well. This is a suprarenal mass. You can see a complex mass on the top of the right kidney, and when we put the color on Doppler, you see this mass is moderately vascular. Neuroblastoma, left kidney, right kidney is normal with normal pelvic system, slightly prominent extrarenal pelvis, but still okay. On the left side, there is a huge mass which is pushing the kidney down. Pelvic system is compressed, but still excretion of the contrast is present. Another case of neuroblastoma, now this time on the right side, you can see the kidney is pushed down inferiorly as well as medially by a large tumor. Contrast excretion is intact bilaterally. Yet another case of neuroblastoma. This is CT image. It's a large tumor. You can see the other structures. You can see the liver, right kidney showing normal contrast excretion, where the left kidney is almost replaced by a large tumor which has probably invaded the left renal vein as well. Lipoma, not very common again. If you look at the right renal pelvis, you see the renal pelvis is occupied by a very low density structure which is comparable to the adjacent fat with very fine septation inside. This is not a cyst, but this is a large lipoma which is present in the right renal pelvis, which is slightly displacing the renal cortex. Contrast excretion is intact. Left kidney is normal. Wilm's tumor involving the right kidney. The right kidney is malpositioned, displaced due to the presence of a large mass. On the left of your screen, the picture is when the contrast is not given. This is plain. On the right of your screen, when the contrast was given, left kidney shows normal contrast uptake. The left kidney, as I said, is displaced, but still contrast excretion is intact. Sometimes there are very small masses in the renal parenchyma which can easily be missed on routine ultrasounds. But if you look at the things very carefully, you can find out these small tumors in the very initial stages. Like we have this small tumor depicted by a large thick arrow in the upper middle pole of the kidney. The left kidney on the right of your screen is okay. Renal mass, intravenous urography has been performed. On the left side, you can see the normal pelvic system with the normal ureter. Urinary bladder is also normal. While you can see a mass on the right side, but you can still trace down the right ureter, means that there is contrast excretion which is present in the right kidney in spite of the renal mass. Left renal mass, you can see involving the upper pole, contrast with the normal and a Doppler image. You can see this mass is highly vascular. HYDRONEPHROSIS involving the right kidney, displacing the pelvic system, malrotation of the kidney, but contrast excretion is still intact. You can see the part of the renal cortex in the upper pole and the periphery as well. The left kidney is normal with normal contrast uptake and excretion. Incidental finding is noted: a gallstone present in the gallbladder in the upper part of the image on the left side. Now there are certain tumors which, when they are not diagnosed in the initial stages, can slowly invade through the renal veins, and ultimately they go into the right atrium through the inferior vena cava. Here we can see the left renal vein invasion by a large tumor which has grown up to such an extent that it is slowly going into the IVC through the left renal vein. Ultrasound picture, you can see filling defect in the IVC. The tumor is coming from the kidney, one of the kidneys, and slowly growing like a snake into the right atrium. Now this is right renal vein and IVC invasion. The tumor is on the right kidney this time, and you can see the filling defect in the right renal vein as well in the proximal IVC. This is the hand picture of the renal vein invasion as well as the mass going through the IVC. Here you can see a left renal vein is all thrombosed with the tumor and is getting up to the right atrium through the IVC, and ultimately the tumor reaches up to the right atrium. Sometimes these tumors are only diagnosed when the patient comes for an echocardiogram. They find some abnormality in the right atrium, and then the kidneys are explored, and one may find a tumor coming from one of the kidneys through the IVC into the right atrium. This is perirenal bleed or retroperitoneal bleeds due to the trauma to the left kidney. You can see the presence of the blood in the left pararenal space. Cobra Head ureter. Now this is the bilateral case. Here you can see the filling defect in the urinary bladder with dilated double density structure. This is a dilated lower end of the ureters, giving a close appearance like the cobra head. These conditions are present in the children, and here you can see the reflux of the contrast on both sides and is up to grade 4. Vesical calculus, very much looking like an egg. It's very well defined border margins, and this is filling the whole of the urinary bladder. Another case of mobile vesical calculus. Cystitis plus calculus. Sometimes the stones are there present in the urinary system, especially in the bladder, with presence of infection leading to the thick walled urinary bladder. Foreign body in the urinary bladder, you can see a thick structure in the urinary bladder. Chronic cystitis due to the presence of schistosomiasis, which is not very common in our country. Another picture of cystitis, thick walled enhancing. Very rare condition, but still we can come up with these things. IUCD present the urinary bladder. Either it come piercing through the uterus into the urinary bladder, or sometimes this is wrongly placed in the urinary bladder through the urethra. here we come up with the end of the discussion, and today's assignment is what is the radiological difference between the fetal polycystic kidneys and the adult polycystic kidneys. My email is Dr. Saqib Javaid Ahmad @hotmail.com. You can put your answer on this. Thank you very much.